Hello and welcome to the latest podcast from the Staffordshire and Stoke-on-Trent clinical commissioning groups. Today we are talking about the NHS and the fact that it's the 72nd birthday on Sunday the 5th of July. Today I'm chatting to Lynn Tolley, who's worked in the NHS for 25 years. We're going to chat about some key moments during the history of the NHS, her reflections and how the NHS has had to cope with an incident on this scale. Lynn, before we get going, please can you share your first memory of the NHS?
My first memory is a personal one. I was 16 years old. I'd been in hospital on bed rest for over a month. I ended up having an emergency C-section and I had a really bad night post-operatively, OBS every 15 minutes because I was so poorly. I had Polaroids at that time, we're going back many, many years, of a child in an incubator. Didn't know whether my child was alive or dead at that particular time. And in the morning, I was a little bit more rousable. And the nurse came in. She had these little heels on. And I remember walking in, I saw her feet first. And she came in and I was a bit somber, really, because, again, I hadn't seen my baby. And she came in and she said, "Is your boyfriend coming today?" And I said, "Yes." She said, "Come on then, let's get some makeup on you." So there she was, getting the makeup out, putting it on me, and she went for blue on my eyes and got the rouge out and all of that to make my cheeks go red. I must have looked like Aunt Sally off Where's It Coming when she'd finished with me. But what I have to say is that I probably didn't thank her that day because I just wasn't feeling it. But if I could go back today, I'd say thank you to her, and I'd love to say thank you to her because she just made me feel like somebody cared. I get really emotional when I talk about it because it wasn't just the emotion of her, it was like not seeing your baby. But, she really, really, I suppose she's an inspiration that I didn't know was there.
A few years later, you found yourself being a mum of two at the age of 25, and you were inspired to attend an open day, am I right, at your college to work in the NHS. What happened that day? What changed your view of the NHS and actually started your career?
So we were at Walsall College, and one of my friends said, "Oh, I'm going up to an open day at Walsall Manor." I thought, "Well, I'll just go with it because I've got nothing else to do." So I went up there and listened to a few people, very inspirational speakers talking about their experiences in the NHS, giving examples, etc. And I can't tell you what inspired me that day or what, but I had to then think, actually, this is something I might like to do because I really didn't know what I wanted to do. I'd left school at just before my 16th birthday, had a child when I was 16, was a mother. So I really didn't know what to do. So I didn't know what I wanted in my life really at that point.
So since that day, you were trained as a nurse and you've done various roles at different hospitals over the years. And now you're working at the clinical commissioning groups in the Quality and Safety Directorate, doing a leader's role really for the team. Can you just talk us through some of those roles that you've done and the role that you're doing now?
Yeah, so actually I started at Wolverhampton as HCA because after I'd gone to the open day, I really didn't know what nursing was all about, to be perfectly honest. So I did that, and then I thought, yeah, I like this, I can do this. So then I went did my training, and I did my training at Walsall Manor. So I started my career at Walsall Manor. At that particular time, believe it or not, there was no jobs. So you really had to skirt around for which jobs you'd go for. And I went for a rehab elderly care, which wasn't the top choice for many people. Got a job there and loved it. I absolutely adored it. Heavy work, but loved it. And gave me so much personal reward on a personal level. But I looked around and actually, did I want to be there forever? Could I make a difference? There were nurses on there that had been on 20 years plus, and it was same old. And I thought, no. So I went to various wards at Walsall Manor and still felt unsettled. There was something else I wanted, and I didn't know what that was. That time I moved again. I went to Birmingham Children's Hospital. And when I was there, it was just enlightening for me. It had true family-centred care, and it was about a holistic approach. So I really absolutely just found my, if you want to call it a vocation, at Birmingham Children's, working with children. And after that, I'd been there about a year, 12 months, did my children's. And while I was on my children's degree, I met someone who was looking after a ventilated child in the community, and she asked me to go and work with her. So I went to work on the community in Lichfield, actually, worked with a child in Lichfield that was ventilated. Great team there, then went on to be a community children's nurse. And from there, went into the CCG, and the rest is history, really.
So that leads us nicely into talking about the history of the NHS. So there's obviously been some key moments over the years, and I think it's nice to kind of look back on how the NHS has changed and what difference that would have made to not just the patients, but obviously to staff who are delivering all those roles. So let's go back to the very beginning, Lynn. 1948, when the NHS was established. Why was it such a big thing at the time?
At the time, there wasn't anything like that regarding health. It was post-war, post-Second World War. You had a whole workforce that actually needed to be built up. You needed a healthy workforce. Your men, because of the war, had been depleted in that sense. So we really needed to make sure we had a healthy and build up our workforce and build up our infrastructure. It was the first time hospital doctors, nurses, pharmacists, opticians, etc. were available and free at point of access and delivery.
And then a few years passed by and we started seeing things like vaccinations being offered for free, some specifically for children and some for adults. That made quite a big difference for the people who were treated for illnesses as well as preventing illnesses, didn't it?
Yeah, absolutely. In the 50s, then we had the polio, diphtheria vaccinations. There's a programme for everyone under 15. And even today, you've got the HPV, flu vaccination, MMR, many, many more that actually keep people safe. And those childhood illnesses that absolutely disabled people, children died and no longer in existence, or they're minimal. You do still see them, but not the rarity.
And I'm going to skip forward another 10 years or so. 1967, the Salman Report was published. Can you just describe what that is and why that was important?
This is a major report making recommendations for the development of senior nursing staff. It acknowledged the complexities of the NHS, and it was important that we made changes in the NHS to allow it to grow.
And then in the 70s and 80s, there were some big changes in technology. Can you just give us some examples of what that entailed?
You had CT scans in the 70s, 80s, you had MMR, scans were introduced, and then we went on to keyhole surgery. Too late for me, though. I ended up with open surgery, but keyhole surgery came in just after, so missed that one.
Yeah. And then there was something quite big that happened in 86. The government launched the biggest public health campaign in history to date at that point about the threat of AIDS as a result of HIV. Why was that quite a significant point in time?
Yeah, this is when it was the AIDS campaign, and it launched the biggest public health campaign in history to educate people. And I have personal experiences that particular time, as I had a relative that was at risk. I also was at that point in the hospital. I was in Walsall Manor Hospital, and I had a particular young man who had got AIDS and was dying, and he hadn't spoken to his parents. And I sat with him, and we had a really heart-to-heart conversation that day about a mother and a child's relationship, etc. And I'm pleased to say he did speak to his mum and dad before his death, and he was given a sidewalk to allow him and his partner to spend some time together. And that was, in 1986, that was really forward thinking of allowing them just to have some private time, really. But we had some fun on Christmas Day. I stayed in the back of his back and everything. We had a bit of a laugh, really.
Then we see in 1990 the NHS and Community Care Act coming out. Why was that important?
That was health authorities being able to manage their own budgets and being able to buy healthcare from hospitals and other health organisations direct.
Skipping forward a few more years then, in 2013, there were two quite big things that happened there that we still refer back to now. So clinical commissioning groups were formed, But locally, we also had the Francis Report that was published. That is still kind of reflected back on even now. What was your involvement in that? And can you just tell us a little bit more detail?
When the actual reports were published, I was head of nursing quality and patient safety. And we worked with local providers to ensure that their recommendations, out of the 290 of them, were actually actioned and embedded. We also, I worked and led on the QIA's quality improvement assessments on the services that were going to be disaggregated and moved over to other providers, which was pivotal really in making sure we had the services safely transferred into new providers. It was massive locally and nationally because all eyes were upon us at that particular time. And we were just after that moving then into clinical commissioning groups were formed. And I've worked with members who are still in the CCG. Definitely one particular member who was doing all of the paperwork till 9 o'clock one night just to get a certain section sorted.
And that leads us to today and how the NHS has coped with the coronavirus pandemic. It's probably the first time really in history that the NHS has had to cope with an incident on that scale. And we've just touched on a few key moments, but that certainly does stand out. Why do you think the NHS has succeeded and coped so well so far with this?
As I talked earlier, the NHS was formed in 1948. It was built on strong foundations. The people who work within it give 100%. And what they've done is they've stepped up, as they always do, to the challenge, but not alone. And we must always remember that they weren't alone when they stepped up. There were many others, local authorities, voluntary sector, nurses and doctors who had retired and enjoying their retirement came back into their roles. Carers, key workers, the public volunteering to support us in supporting the NHS. So people value the NHS more now than ever. It's a pivotal part of our country. We've discussed that it's free at point of access. And it feels to me like we've gone back to 1948. There was an article and it said the NHS came kicking and screaming into life on the 5th of July 1948. Well, I think today the NHS has come out fighting in 2020, and it's demonstrating that the NHS is one institution that will never let you down.
Very powerful words, Lynn, and I think that just reflects on your kind of journey through the NHS and your role now that you do. How has your role changed as a result of the coronavirus? What have you seen different in your particular day-to-day activities and your team?
Well, obviously we've had to continue with the quality and safety aspects of our role. You can't take your eye off that at all. But more recently, I've been involved in the testing cell, and where the quality team members, with the support of the Civil Contingency Unit, Stoke-on-Trent football grounds, the Army, within 5 days set up 2 sites, one in Burton and one in Stoke. It was operational within 7 days. That's an amazing accomplishment. And as I say, all those people working together tirelessly over those 5 to 7 days. Just amazing effort, really. Infection and Prevention Control, we've got an amazing IPC team, Midlands Partnership Foundation Trust. And we have also within Burton Hospital and in Stoke IPC teams. They've all worked in the community supporting care homes with IPC packages. In early May, the Chief Nursing Officer sent a directive to all CCGs, Directors of Nursing, to ensure that IPC packages training was delivered to a certain standard, to a national standard. We had to do that by May the 29th. We would have never achieved that had we not had a combination of local and national coordination. It was a tremendous effort by all, and we achieved the 100%. And actually not many CCGs did that. And I can hand on heart say that we did it in the truest sense. And that was it was a local and national effort to do that, and we got there. So it was absolutely wonderful. And we're extending that now actually to extra care support, supported living, private hospitals, individual care packages and dom care. And that's just to name a few. So that's all being expanded because it's not just care homes we have to think about, it's wider care sectors we have to think about as well. And also during this time, my role has actually enhanced my working rate. I had good relationships previously across the whole Staffordshire and Stoke-on-Trent, but this has really strengthened those. We have safe conversations, we have very challenging conversations, but the importance of working in partnership across the trusts, whether that's acute, community, whether it's local authorities, private sector, it's provided invaluable for the fight against coronavirus.
In just 3 words, Lynn, can you describe why the NHS is unique?
You'd expect me to say caring and compassionate, so I'm saying those 2 words, but actually it's inspiring would be the last one that I would pick up on, because it has inspired me in many ways, whether that's personally, emotionally.
For someone who may be interested in a career in the NHS, what would you say to them?
Well, I started my career as an auxiliary nurse following the open days we discussed earlier. You can say it's a calling. That's what some people say. It can be something you want to do as a child, dressing up, just want to do as a child. Some even say it's a vocation. But what I will say, it's given me the most wonderful career. I've had an opportunity to work in a variety of roles until I found the one that inspired me at Birmingham Children's. I've been able to feel, hear, see emotion. I've cried with sorrow, but most of all with joy. Patients, families and carers at the heart of everything we do in the NHS, and I'm proud to say I'm being part of it.